Hi, I'm Jenny Hewitt, physiotherapist, member of the Australian Physiotherapy Association and one of the authors of the Sunbeam program, a successful exercise program that resulted in increased physical performance and reduced falls in residents of aged care. I'm thrilled to be able to share our findings on best practice exercise for residents. We'll be working through the implementation of the Sunbeam program together, with the aim of giving you the knowledge, skills and confidence to be able to put this into practice. The Sunbeam randomised control trial was performed initially as there was a mismatch between what I was seeing as a clinician in residential care and what was reported in the literature. As a clinician, I saw residents making life-changing functional gains with the right type of exercise, but there was no convincing or consistent evidence of that in the research. The key message here is what is the right type of exercise to make a meaningful change to physical performance. As allied health professionals, we know that exercise should be viewed like medicine. It needs to be the right type, the right dose, and the right frequency to have a therapeutic effect. To apply these principles in residential care, where people are generally of advanced age and often with chronic conditions and multimorbidities, takes expertise and confidence. In the beginning, I needed to dispel some of my own concerns and insecurities about this. Some of the myths I was inclined to believe back then were that any type of exercise was better than nothing. But when I looked into the research, I found it just wasn't true. For example, introducing a walking program for previously sedentary residents without addressing their balance or strength deficits increased their risk of falls. I found that seated exercise alone would not improve balance and reduce falls, and light exercise might increase range of motion but not strength. So what is the right type of exercise? Best practice guidelines recommend at least 50 hours of exercise over a 6-month period, including high challenge balance exercise, progressive resistance training for those who are deconditioned, and all exercises need to be individually prescribed and upgraded, with a maintenance program at the conclusion of the conditioning phase. So together with an amazing multidisciplinary team, including Professor Catherine Refshorgi, physio, Lindy Clempson, OT, Tim Henwood, exercise physiologist, and Stephen Goodall, health economist, we conducted the Sunbeam trial with 16 residential aged care facilities and 221 residents. 8 villages continued with usual care and 8 implemented these best practice recommendations. We found a 55% reduction in falls rate and a statistically significant improvement in physical performance in the group that performed the exercise program. And this was the first time that such a positive result had been found with residents of aged care. Today I'm thrilled to share the implementation of this program with you so that you can translate this into practice with your own residents too. This video will be delivered in chapters to enable you to skip ahead in the future to sections you'd like to review. The first chapter is on initial individualised assessment and how to perform standardised physical performance outcome measure. Next is how to implement the resistance training component if you're fortunate enough to have a gymnasium at your village, which is the protocol we used in the Sunbeam trial. But we recognise that not all villages have these facilities, so Chapter 3 demonstrates how to adapt the program and include training for the same muscle groups using more easily accessible equipment such as bands or free weights. Next we'll cover the safe prescription and progression of high challenge balance exercise, which is absolutely paramount in falls prevention. Chapter 5 will be tips and tricks. I'll cover practical ways to adapt to common conditions and ideas to spice up the program if it becomes repetitive. We'll then wrap up with information on where to find resources to support you along the way. So, let's get started. Allied health professionals are accustomed to taking detailed initial assessments. For this program, each resident is assessed individually. This includes a comprehensive investigation into all current and past conditions, medications, past medical and surgical history, current areas of pain, injury and weakness, as well as any other clinically relevant details. Each allied health professional will need to use their own clinical reasoning skills to determine the suitability of the program for each person. You'll also need to customise the program we teach today to suit the abilities, relevant medical conditions and preferences of each resident. That is why the program is prescribed and progressed by a registered allied health professional with assumed knowledge on conducting assessments. We have developed a standardised assessment form though that may support you to carry out the process. This resource, along with other supporting materials I mentioned today, will be available on the web address found at the end of this video. Now we'll show you how to use the short physical performance battery. This includes 3 tests of physical performance. First, a gait speed test, then a 5 times chair stand test, and then a balance test. The gait speed test involves 2 attempts with the resident walking 3 metres, walking at their usual pace with their usual walking aid.
And we're on.
We record the fastest time.
Keep going past, keep going, and we're off. That's it.
The chair stand test involves asking the resident to stand up and sit down 5 times from a chair, unaided and without using the arms of the chair.
3, good. 4 and 5, and sit down, have a rest. Good, great job. So that was really good, well done. Not everyone can do 5 times in a row, so good on you. What we're going to do is measure that again every 4 weeks and just track how you're improving. And the exercises that we're doing should make it easier, so you'll be a little bit stronger and you can usually do it a bit faster, and that's how we'll know how you're going.
Oh, that'd be good.
Yeah, good on you.
Once again, we record how long this takes and score accordingly.
So one more go. Try and stand up without using your hands. 1, 2, 3.
No,
Too hard?
I'm not going.
That's all right. Well, this test is a hard one, but what it tells us is that the muscles in your thighs and your hips are a bit weak, and that's what this exercise program's all about.
Like that with the push-up.
No, well, that's the thing. That in normal life you'd use your arms, but this test you don't use your arms. So we're going to work on the muscles in your legs and your hips, and then we'll test it again in a month and see how you go then. We'll test it every month because we're doing this for 6 months, and I'm pretty sure that by the time we've been doing it for 6 months you'll be able to do that.
I hope so.
I hope so too.
The balance test involves the resident attempting to stand in 3 challenging balance exercise positions. First of all, with the feet together, we see if they can hold that for 10 seconds. If this is successful, we progress to the next level, asking them to stand in a semi-tandem position. Once again, we ask them to hold this for 10 seconds. If that's successful, we progress to tandem standing, where we ask them to hold that position for 10 seconds.
The short physical performance battery is recorded at the beginning of each 4-week period, and of course at the end of the last visit at 6 months, so we can track and see what kind of improvements our residents have made. We used 5 pieces of equipment during the Sunbeam trial, including hip abduction, adduction, leg press, triceps dip, leg extension, leg curl, and abdomen back. Each resident's program was individually prescribed and upgraded by a physiotherapist during the 6-month protocol. We ensured that each exercise was performed at a level where the resident reported a moderate to somewhat hard intensity using the Borg scale of perceived exertion after 10 to 15 reps. Mostly we stuck to 10 to 12 reps. So if someone felt an exercise was now somewhat easy after about 12 reps, we'd increase the weight. Prescribing a generic 3 sets of 10 reps of light exercise where everyone in the group does the same weight just won't get the same result.
We recognise that not everyone is fortunate enough to have access to this type of equipment. So I've developed a resource to list each of the exercises needed to carry out a program as close as we can to replicating the Sunbeam protocol. The first page describes the key principles of exercise dosage and prescription, including tips on how to perform each exercise and how to record the exercises performed each time. Remember, it is really important for resistance exercise to conduct 2 to 3 sets of 10 to 15 repetitions at a resistance that the resident reports is moderate or somewhat hard on the Borg scale of perceived exertion. This is determined during the individualised assessment.
Blue means it was easy, green means it was a little bit hard, and red means it was terribly hard. So what would you say those exercises felt like? About there. We're actually aiming for 12 to 15 on the Borg scale of perceived exertion. And around this early green part of the scale is where we're aiming. So that's the right weight for you.
Yeah.
Now what I'm going to get you to do is sit up nice and tall, tummy in, shoulders back, and start to straighten your leg out. It's quite difficult. Can you get any straighter than that? That's actually too hard. All right, let's take it back one level. So even though it's only blue, I think that you're going to find that quite a challenge. You want to have a go? 1, can you get it any straighter? 2, keep going. 3, 4, 5, we're aiming for 10. Are you going to be able to get to 10?
Yes.
8, 9, and 10. Well done. So would you say that was easy, moderate, or a bit hard?
A little hard.
Okay, so that's a good level for you.
This is a resistance training component of the Sunbeam program, and it needs to be progressive. This means that we'd expect sets, reps, or dosage of each exercise to be increasing over time, at least every 2 weeks, but sooner if needed.
Now, if we wanted to make it harder, obviously we can change the band to a higher resistance. But the other things we can do is make it shorter, so tie the loop so it's a little bit shorter. Or we can slow the movement down so that you do a 1, 2, 3, hold, 2, 3, down, 2, 3. All of those will result in a higher resistance and a harder exercise without even having to go to the black band.
This process is repeated for each of the exercises on the protocol. Knee extensors, knee flexors, hip abduction, hip adduction, seated triceps, and standing calf raise. The Sunbeam program included resistance and balance exercise. It is also essential that the balance exercises are prescribed at the right dose to achieve best outcomes for residents.
Jerry, what we're going to do now is just see how your balance is, because in our class we'll be doing strengthening exercises and balance exercises, okay? So first thing I need you to do is to stand up. You can use your hands for this one. Oh, that made a difference.
Does make a difference.
Just pop 2 hands on here. What we're going to do first of all is just get your feet apart, but sort of straight under your hips. Standing up nice and tall, and take your hands off. And so you're not wobbling much, so that's telling me that that's too easy for you. It's not going to be challenging enough. Yeah, so put your hands back on, and now we'll try feet together so they are touching each other, including the toes if you can. Bring the toes together. Sometimes your feet can't get together because your knees knock. So if that's as close as you can get, that's good.
About it.
Righto, standing up nice and tall, hands off. Now there's a little bit of a sway there.
Yeah, I can feel it.
Yeah. Let's try the next level just to see how you go. So the next level is called a semi-tandem. So you take one foot slightly in front of the other like mine are, and it doesn't matter which foot, you just choose whichever one you feel strongest with. Probably a bit further forward, I'd say. That's it. I'll move the chair a bit so it's not in the way. That's it. Now stand up nice and tall again. Take one hand off. Do you feel like you can take the other hand off?
Try.
Yeah, this is about the right challenge because you're actually having to concentrate there, aren't you? Yeah. The other one was a bit easy. So I'll record this as semi-tandem, right foot forward, no hands. Stand up tall, that's it. Nice job. When you do an exercise program like this, we want to do strength work and balance work because you need both strength and balance if you want to stay on your feet. So some of the balance work involves reaching from one side to the other and seeing whether you can keep your balance, because a lot of people have a fall when they reach and then they topple. So we're going to practice it. So you have your feet a little bit wide. I'll show you first if you like. And then we're just actually going to reach from one side to the other, rocking like you're on a boat. So we'll start off with your hands on there and sort of rock from side to side. And then we'll try with just one hand, and then we'll see how you're going with just no hands. And I'll stand here to keep you safe while we check it out. Is that all right? Now what we're going to do is just rock from one leg to the other, and as you put your weight on here, so come to me and lift your other heel up. Oh. Yeah, that's it, rocking. Woo, that's perfect. Side to side. Side to side. Now, you're doing a good job of that. Now what we're going to do is take one hand off and see how you go with your balance like that. Side to side. Good. And then take both hands off. Whoop. Good. So this time when you tip to the side, we're actually going to lift one foot up and then to the other side. So that's what happens when you're too good, we make it harder. Oh, no. So do it with both hands on first. Rock towards me and lift the other foot up, and then change to the other side. Woo! Side to side. Side to side. Okay, try one hand. Yeah, that's a bit harder, isn't it? And try no hands. Woo! That's it. You probably are going to be doing
wider.
You are getting a bit wider. And you're exactly right. That's how you make it harder. You can stop for a minute. Is that in time that'll become too easy for you. So we will do it with your feet quite close, and that makes it much harder. But for now, it's about right with your feet wide apart and no hands on. Yeah, that's it. Not yet. So the next exercise is probably the hardest balance exercise of the lot, and it's designed to help you if you start to fall to be able to catch yourself. So it's no good having strong muscles if you can't move your foot quickly, and it's no good having a quick foot movement if your leg's weak and it buckles. Oh, yes. You need both. So what we're going to try and do with this one is start to tip and then catch. So it's a bit like falling, falling, catch. It's a little bit scary, but that's why I'm standing here alongside you. So are you happy to give it a go? Yeah. All right, let's get you standing up. Hanging on here with two hands. Now we're going to go away from me, and what you do is it's a little bit of a tip to the side, and then like you're actually going to tip over, and then you quickly put, that's it. Have another go. Falling, falling, and catch. Ooh, good on you. Lovely. Another one. Falling, falling, and catch. It's the catch that's the important part, not the falling, falling bit. All right, let's take one hand off and try the same thing again. That was a look, I saw it. Let's try it. Good. And again. All right, nice. And now for our grand finale, we're going to try it with no hands. I'm right here, you won't go. Okay, have another go. Good. And one more. Good. That's it. Rest.
The group therapy program is to be run with an allied health professional and 4 residents, each performing the exercises at their own individually prescribed therapeutic dose. The aim is to make sessions both specific and challenging enough to help residents regain physical performance, but also enjoyable to address isolation and loneliness. It is up to the allied health professionals to develop an environment where residents want to be, that they look forward to and embrace. Infection control is paramount, so we use snap-lock bags and individualised bands. Each band is cut to about 120 centimetres in length, so we get around 20 bands per 25 metre box. Every resident has a bag labelled for their own use, containing their own bands. Other equipment is cleaned using appropriate strength alcohol as per each village's standard protocols. Other infection control directives given by each facility are also adhered to. Some common scenarios that may need different attention include protection of fragile skin, a variation for triceps, inclusion of weights if the bands are not strong enough, and wheelchair variations. This resource has been provided on the website to list exercises to help guide you on the program delivery, but also to minimise record keeping time.
Each sheet records 4 weeks of training, and we ask that you repeat the short physical performance battery at the beginning of each 4 weeks. This will let you and the residents know if they are improving, and also help us to see how the program affects residents. It is important to document cancellations as well as progressions. The Australian Government is funding an evaluation that will include factors such as how many sessions people attend, whether they were able to adhere to the program, and how their physical performance changed over time.
Over the years of implementing the Sunbeam program, it's become really clear to me that it's not just the exercise that's important, but also the sense of enjoyment, pride and belonging that really helps residents. It's up to us as allied health professionals leading the program to foster this in our sessions. We can group people together with similar abilities, but sometimes it's better to group people with similar interests together. Perhaps bring someone in who's shy with someone else who will take them under their wing, for example. Having a resident who enjoys motivating the group might help others who are not so motivated, for example. It's really up to you to figure out the best combinations that will make the program something that everyone, including you, will look forward to. This program can then have benefits that extend far beyond just addressing physical performance. We've tried different ways of making the balance exercises fun too. You can see here photographs of the residents working with Nerf guns, football, playing games, doing circus acts. It just helps to spice it up a little. If you find that you're getting more efficient over time and the exercises are finishing earlier, feel free to add other exercises or activities into the program too, as long as you keep those foundation exercises that have proven benefit. Variations not included on the record keeping sheet can be recorded by you using standard record keeping at your facilities. We often also use music and ask the residents to request songs or genres to build a playlist. Creating a space for socialisation before and or after the exercises can also help build momentum and excitement for the sessions.
Well, I've been coming to the gym about 3 times a week for about a year now. Well, I can honestly say the gym is the best thing since sliced bread with the honey on it. I think the strength in my muscles, I wasn't so weak as in the body. You're going like that a little bit. You can straighten up, you can walk tall, a bit more confidence. My quality of life is definitely a lot better since I've been doing the exercise.
A world of difference. I can walk taller. I'm just so much more able to get about. It's wonderful. As I said, I was a couch potato and I didn't move, and just one day was like the other. Now I look forward to the exercises very much.
Leg-wise, strengthening your legs, to be able to push up from the floor without your hands and get down into your chair and up easily, and just generally overall they strengthen the body.
I hope this video has helped you to feel inspired to implement the Sunbeam 2 program at your villages. I'm super excited that we have an opportunity as allied health professionals to implement an evidence-based program and demonstrate one of the many benefits that allied health can deliver residents if we're given the opportunity to implement best practice. By carrying out the program and recording your residents' progress, we'll be able to evaluate and report on how this type of approach benefits residents. I hope that this is the start of a new chapter for residential aged care, where allied health is empowered to do our best work. Enjoy!